Welcome to Rural Health Pulse. I'm Jim Kinnear, Chief Human Resources Officer at the Indiana Regional Medical Center. In this series, we focus on ideas and stories impacting the health of our region and explore the programs and initiatives designed to improve healthcare and wellness. This podcast is a collaborative effort of IRMC and Indiana University of Pennsylvania. In this episode, we are learning about rural healthcare by speaking to a representative of Punxsutawney Area Hospital, a top 20 and top 100 rural hospital. Our guest is Ms. Katie Donald, Public Relations and Marketing Specialist at Punxsutawney Area Hospital. Katie, welcome and introduce yourself to everyone, please.
Hi there, my name is Katie Donald. I work for the Punxsutawney Area Hospital. I am the Marketing and PR Specialist for our organization. I do some recruitment as well. I'm an active role in our PA Rural Health Model program, and I also work with the Community Health Needs Assessment. So I keep busy doing a wide array of things, but I want to thank you for letting me join you today. I'm excited to be here and to talk a little bit about the Rural Health Model.
Well, it's great to have you here, so thank you so much for coming. To get started, can you tell us just a little bit about Punxsutawney Area Hospital?
Sure. So Punxsutawney Area Hospital is a 49-bed facility. We are located in Punxsutawney, of course, Jefferson County. We have about over 420 or so employees, so we're one of the largest employers in Jefferson County. We are an acute care facility. We're really excited this past year. We've been named a top 20 rural and community health hospital by the Chartis Association, so we're really excited about that. We work really closely with IRMC, obviously with PMCN, so we're very fortunate to have that relationship. We do share some physician staff and provider staff, so we're able to bring services, certain specialty services to Punxsy that we really wouldn't be able to do so without the assistance of IRMC, so we're very fortunate for that. But we're a small town organization. We're proud of who we are, and we're really excited to continue working in the health industry and moving forward.
Well, thanks for sharing that background information. You mentioned the rural health model. Could you tell us a little bit more about that?
Sure. So the Rural Health Model is a program that we've been participating in since its inception, or our inception with it, which would be 2019. What this program is you work with the state and you come up with different goals and initiatives for your organization to work towards. Some of those can include social determinants of health, access to care. Basically, it's different things where you can improve your services for your constituents and be able to provide the services that are needed to your community.
What are some of the advantages of participating in a program like this for Punxsutawney Area Hospital?
So some of the advantages would be there is a financial advantage to participating in the program, so that's great. Also, the resources, we're connected with all the other rural health hospitals in the state, so we're able to kind of bounce ideas off of them, talk about our plan, their plan, see what works best, what hasn't. And we're also really closely aligned with the PA Rural Health department as well. So we have their expertise available to us, and we're able to use them as a resource as well.
Have there been any particular accomplishments or initiatives because of the rural health model that you're most proud of?
I would say for our organization, we've come a long way since the start of our transformation plan and the rural health model. There are some specific that I'm most proud of. We do an annual blood screening program. It's a comprehensive screening program for our community. We have been doing it for a number of years. However, with the help of the rural health model, we've been able to make it more of an initiative for our community as well. So what we do is we have the folks sign up for the program. They do their blood screening, and then we provide them resources. We'll connect them with providers, give them educational opportunities, and provide them with information from credible sources like the American Heart Association, the American Diabetes Association, just to kind of work towards the preventative care for our community. So that's one of the areas where we've determined in our community health needs assessment as well that is a high need for us, and that's preventative care. So that's one of the things I'm most excited about. There are different clinicians that are excited about different initiatives along with it, but another one I would say would probably be our work with IRMC and being able to provide the services, like I mentioned, for specialty services to the people in our community. So that's one of the great things about it as well.
It's great to hear how Punxsutawney Area Hospital is so involved and engaged with the community, and that whole idea of public health and understanding what some of the specific issues are and how we can address those. What do you see as some of the biggest challenges in regards to public health in a rural community?
So some of the biggest challenges, I can speak to my community. I'm sure Indiana may be similar, obviously being nice and close. With our community, it's health literacy. Our individuals in our community may not have an awareness of, the technicalities of health and, what kind of all goes into it. Another thing would be broadband. We don't necessarily think of broadband in health, but in, the telehealth and the telemedicine era, we do see lots of challenges in our community with not having the accessibility to broadband. And then just overall accessibility in general. We are a rural community. We are very large population-wise, landmass-wise, so a lot of our folks do have issues with transportation, and that's another area where we see issues would be, transporting folks, getting them to our facility, from our facility, or say we get individuals that will come to our emergency department via ambulance, and then they won't have a way home. So those are some of the challenges that we see in our community.
Thanks for sharing those. And both transportation and broadband are topics that we've heard about with other guests as well as being major issues affecting the rural communities. You also mentioned that Punxsutawney Area Hospital was recently recognized, and I believe you've received a couple recognitions. Could you share a little bit more about each of those with us?
Sure, absolutely. That's one thing that we love talking about is our recognitions that we received. So for the past 4 consecutive years, we've been named a top 100 rural and community hospital from the Chartis Association, and it values different measures, including patient experience, financial components as well. So we're excited about that, but our biggest accomplishment in the recent few years has been named a top 20 rural and community hospital. So out of the 800 or so rural hospitals in the nation, we are in the lucky 20. We don't know which one. I like to think number 1, but we'll just take it for what it is, and we'll say top 20. So it's great to be able to share that with our staff and our community and our patients. They know that they receive excellent care when they're with us, and we have the ability to provide them the services that they need, and it's just really great for our organization to be recognized for our efforts, especially during the pandemic and all of everything that comes along with that.
Well, congratulations, and I think that's very exciting to think about being one of the top 20 rural hospitals in the nation. Very impressive.
Thank you very much.
So tell me, what do you think are some of the things that your hospital is doing well to earn that recognition?
I would say some of the things that we're doing well is our patient experience. We do value our patients just like any other organization would. For us, and I'm sure Indiana is similar, you walk in and you see your neighbor, your grandma, your loved one, your best friend is there for services. There's always a familiar face and familiar component to it. We know the people that we treat, and that's one of the things that can be good and bad, but for us, it's always been proven to be something that we've excelled at. So caring for our community and caring for our loved ones is one of the areas that we do work great at. I would say another one would be, associating ourselves with organizations like IRMC. We don't have all of the specialties. We don't have everything, that folks do need, but we do have the resources and the abilities to get you what you need at a tertiary facility or somewhere else that may have the specialty that you are in need of. So we do have those connections, and that's one thing, that we're also really, proud of and excited, and another reason why I feel that, we've been able to achieve such accomplishments.
So as you shared that, you just hear the importance of partnerships and relationships to rural health entities, that you have a lot that you do well and that you can do yourself, but it's also knowing when to work with other organizations at times. Is that accurate?
That's very accurate. One of our goals that we have this year in our rural health model is The social determinants of health, different elements of that. So food insecurity is a big one with those. So we know as an organization, providing health care and wellness to our community is our main goal, but we need to be able to assist as well with the food insecurities. There are food banks in our community. There are programs through our school district as well. And basically, a lot of that is just kind of collaborating all that information together and providing it to folks so they know what resources are there and available. Being a small community, we do have resources. It's just, building the awareness is one of the big things. So that's one of the areas that we're focusing on for the rural health model. For the upcoming cycle, a lot of our goals are in relation to that.
I think that's something that you hear from many healthcare organizations, that a patient comes looking for healthcare services, but we often find out they have a lot of other needs, and how to connect them with other resources and things that help to address some of those underlying conditions, in turn, may mean that they don't need to use healthcare services as much in the future.
Yes, that's very true. Take food insecurity, for instance. It kind of relates back to obesity and, the health of children, and then it goes into dental care. I mean, it's all encompassing, the social determinants of health. It's all related, and the more you think about it, the more intertwined that you see things, and you're able to connect the dots. Being able to offer the awareness of what's available in the communities, a huge thing and really beneficial to our residents. So we're really excited to be able to work on those initiatives for this coming year.
As you think about things that are coming up, what are some of the future goals that you're planning on working on in the next year?
So one thing we're really excited about is we recently received a SHIP grant, and with this grant we were able to purchase a mobile wellness unit. So this mobile wellness unit is a giant bus, essentially, and what we plan on using it for is outreach to the community. So I had mentioned that transportation's an issue in our community. One thing that we'd like to do is to take health screenings to I like to call them the suburbs, the boroughs or the little townships of the areas around our community, to be able to offer services to those that may not be able to make it into town. Being in a rural area, and you guys as well have Amish population, and we need to be able to serve those folks too. Whether it's to go to Smithsburg and take this bus there to do, blood pressure readings or anything that may be necessary. This is really going to be a way for us to do community outreach and go to our patients and constituents, and be able to assist them in the closest proximity to their homes.
Well, that's great, taking healthcare to the people where they live.
Yep, mobile wellness on wheels.
As you think about, rural healthcare providers like Punxsutawney, what would you say are the biggest challenges that you're facing in the future?
For rural health care providers, I would say getting the folks here. Obviously, Punxsutawney is not like downtown Chicago or Pittsburgh. It's not necessarily what you see on TV and, really riveting and challenging clinical things at all given points and times. One thing that we do have, though, is we have a small town community. We have good people. We have a great school system. We have, different churches. We have, businesses to support the community as well. We are close to the larger towns. Indiana, we're not that far from Pittsburgh, so if there's something that you are in need of, you don't have to go too terribly far. We have a lot of rural beauty and things associated with that, outdoor recreation. Being from Punxsutawney, Pennsylvania all my life, I do value the outdoors and what we do have available, and the trails are great. People like hunting, fishing, all that fun stuff. But so there really is a lot of opportunities there. It's just getting people to take the bite and come and at least take a peek and see us.
Well, you describe a beautiful scene there, and a great quality of life, and living in a rural community has a lot of advantages that sometimes can be overlooked. I understand Punxsutawney also has some growth plans and some updates coming up to the facility. Are you able to share any insights into that as well?
Sure. So we are going to be starting a project. It is an ED expansion project and an outpatient remodel project. We will be increasing the size of our emergency department. And we also will be doing the laboratory services and the radiology services as well. So we'll be able to bring in some new equipment and be able to update some things, be able to accommodate additional folks in our emergency department. It is very dated. If you go to ours and then you probably go to RMCs, you'll think we're, from the past, which it does seem that way. We are making some updates, to better assist with the patient population that we are seeing. So we see a lot of mental health challenges coming in, whether that person may be suffering from overdose or, a mental health issue. We're going to be able to have a place to accommodate those folks until we can get them to the care that they need. So we're really excited about this project. It's going to take some time. It'll be done in phases, but we're really excited. The staff is excited, and we're looking forward to continuing to be such a strong force in the community of Punxsutawney and being able to continue to provide health care.
It sounds like a great investment to, as you said, to continue to provide health care and to continue to be there for your community. Are there any other things that you would like to share about Punxsutawney Area Hospital that we haven't had a chance to discuss yet?
Sure. So our organization is, a small organization, but we do a lot of great things. We have a lot of community seminars and educational seminars that are open to anybody to attend. You don't have to be a resident of Punxsy or a patient of Punxsutawney Area Hospital. We usually do those once a month or so. The one coming up will be a cholesterol one. We've done on heart health. We've also done on our CHF clinic, a few other things, a women's health fair. So we do have different things that you can come and see us for. You don't, like I said, you don't have to be a patient, but we, welcome you to come and check out our facility. And, if you're ever in need of anything, just let us know or let our MC know, and I'm sure we'll be able to assist you between the two of us.
Well, thanks for sharing that. And thanks so much for being a guest here today. It's so impressive to hear all the great things that are happening at Punxsutawney Area Hospital. And once again, congratulations on your recognition and honor. It sounds like it's well-deserved after a lot of hard work.
Thank you very much.
Punxsutawney Area Hospital is an example of a local healthcare provider providing critical access while also delivering high-quality and value-based care in a rural setting. Rural Health Pulse is a collaborative effort of the Indiana Regional Medical Center, Indiana University of Pennsylvania, and the Indiana community. It is produced by Chris Korn from IUP's Division of University Advancement and recorded by the IUP Communications Media. I'm Jim Kinnear. Thank you for listening, and be sure to watch for future episodes of Rural Health Pulse.